Now we spoke about fundal height. So fundal height, we're now saying, is kind of like, you know, from this pubic symphysis up to wherever you are seeing the head. Let me just literally the head of the uterus. So head of the uterus is the fundus. Do you understand? So is it here? Do you understand? It helps you to be able to know the gestational age that a baby is at. Do you understand? So how can you be able to measure it? All right, how can you be able to measure it? Because let me say, in like practical examinations, clinical examination, all those OSCE, you can be asked. Okay, so how do you measure fundal height? I've defined it. Now let's define it properly. Okay, this is way of introduction. Fundal height is simple, is a non-invasive way. It will help you to know how a baby is growing. It can help you to estimate for how long that pregnancy has been there. All right, so it's typically like, it will give you more accurate results. That's after the pregnancy has hit week 20. From week 20 up, it's much more accurate now. Okay, so how do you measure it? You position the patient first. So the patient is actually to lie on their back with their legs flat. Do you understand? Empty the bladder. So before then, you ask them to actually what? Urinate. Expose the abdomen to ensure the area between the pubic bone and the top of the uterus is accessible. So from here, in our hospital, we always ask the women to wear tights when coming to the clinic. Do you understand? So that even if you expose this, you know, everything down is covered. So identify landmarks. So the pubic symphysis is a bony prominence just above the genital area. Identify it. The fundus, that's like the head of the uterus, you also identify it. Okay, so it keeps moving up because the baby is getting big, the baby is filling up the uterus and is shooting up. Do you understand? So it's just as simple as that. So use a flexible tape. Place the zero end of the tape at the pubic bone. Stretch the tape vertically over the abdomen to the top of the uterus. Record the distance in centimeters. Okay, so just like I told you guys, from week 20 it gives more accurate results. So if you get 28 centimeters, it's week 28. If you get 24 centimeters, it's week 24. So deviations, sometimes the baby could have complications in the abdomen. Do you understand? So if you know that a baby is 24, you know, weeks gestational age, and you are measuring this and you are getting 19 centimeters to show that there's something that is compressing the growth of the baby. So it helps us to also diagnose complications. Then multiple gestations, of course, if you have twins, triplets, quadruplets, of course the growth will not be like the one of one child. Do you understand? So this is a traditional method. It has its own limitations. Okay, so ultrasound being the best way to actually, you know the gestational age of a baby. Okay, so that's it on how to measure fundal height.